COVID-19 pandemic with a whole of government and a whole of society approach, emphasizing quick response, resource management, and strategic communication. To guarantee health system resiliency on the road to national recovery, the Philippines is ramping up the country's testing capacity with increased licensed testing and mega swabbing centers, clearly defining patient pathways for both COVID-19 and non-COVID-19 patients through province and citywide community-managed healthcare provider networks, defining the guidelines for mass repatriation and quarantine for migrant Filipinos, developing guidelines on non-pharmaceutical interventions as we transition to the new normal. We commend Dr. Tedros for his leadership and thank the WHO for being the primary external support for the public health and clinical management of the pandemic and for emphasizing the UN framework for socio-economic response to COVID-19. We are participating in WHO's Solidarity Trial using 4 treatment regimens. Looking at the future, we call on the WHO to put a spotlight on the global code of practice on the recruitment of migrant health workers in a pandemic. Universal healthcare in countries of origin, transit, and destination should not leave behind the migrant populations. We also call for sustained support for the WHO Health Emergencies Program to help countries with weaker health systems. And lastly, the Philippines appeals to the WHO to facilitate regional and global solutions in the procurement of PPEs, testing kits, and medical equipment in view of the global shortage. Fellow member states, as we fight the pandemic, you have our firm commitment to stand shoulder to shoulder with you in working for a safer and healthier world. Thank you.
May I now invite Belgium to be followed by Kenya.
To healthcare workers across the world for their dedication during these challenging times. So, Chair, Belgium fully aligns to the statement made by Croatia to the WHO and its leadership. So allow me to make a few remarks, colleagues. First, a reliable and coherent monitoring of the pandemic is key. Unless we all register data in a uniform way and effective monitoring is more effective and also solidarity, we count on the WHO to help us create instruments to assure the equitable access to a possible vaccine. Belgium has a strong tradition regarding the development of new treatments and vaccines. We recently allocated 5 billion euros to CP to quickly test and evaluate the efficacy of vaccines for humans. Accessible primary care health service in order to mitigate the collateral damage of this crisis. We should avoid interruptions to essential initiatives on vaccination, sexual and reproductive health, HIV, AIDS, TB, malaria, and neglected tropical diseases.
Kenya to be followed by Cote d'Ivoire and then France. Honorable Minister, I'm afraid we cannot hear you.
Since the establishment of World Health Organization. On behalf of the government of the Republic of Kenya, I wish to reaffirm our commitment to WHO and its leadership, led by Dr. Tedros, as it spearheads multilateral efforts in the response to COVID-19 pandemic. Kenya reported its first case of COVID-19 on March 13, 2020. As part of its preparedness, President Uhuru Kenyatta issued an executive order on February 28, establishing the National Emergency Response Committee on COVID-19. Since then, we have put in place economic, social, and public health measures aimed at interrupting the transmission of the virus within and beyond our geographic borders. Madam President, Kenya is making significant and steady progress towards flattening the curve. We have learned many lessons along the way and continue to apply mitigating measures day by day. Planning for the current situation as well as COVID-19, we aim to build greater resilience in our health systems through increased investments in primary healthcare and health commodity security as critical pillars towards the attainment of universal health coverage. The lessons learned from this crisis has reaffirmed the need for regional, global, and